While that is happening, let me just quickly say some opening remarks. First of all, thank you for coming. These are very strange times. We're all struggling for the last 6 months to respond to this crisis. It is not going to go away anytime soon. It is impacting our daily lives, our economy, our work, and the supply chain professionals among us have to respond in twice the manner we're normally doing, not only for the COVID supply chain, but all the other supply chains that are getting affected and will continue to do so. So this is a very important webinar that we are doing with you. We've actually conducted a very similar one with WHO across 11 countries, and several other countries have requested for the same. And so in partnership with the University of Rwanda, we've decided to offer it again across not only the East African community, where our partnership is with the University of Rwanda, but globally for anyone who is interested. So with that, is somebody able to share their screen? And if not, Professor Kayumba, are you able to share your screen with the slide deck? Or would you like me to do it?
I will do it. Let me share the screen.
Great.
Can you see my screen?
Yes, clearly.
Thank you very much, Prof. Paul, for the introduction. So it's always a pleasure to partner with your institutions like yours, and especially when it comes to very specific periods where we are going a pandemic disease. And obviously we are mandated to tackle and curb that disease by different means. And when it comes to this noble profession of supply chain management, this really webinar comes on the right time. Thank you very much, East African community participant and any participant outside EAC region. We are delivering this as a joint efforts between the East African Community Center of Excellence for Vaccines, Immunization, and Health Supply Chain Management. I hope you are all familiar with these common rules for webinars. You have to mute our mics. If possible, turn off the video so that the communication goes smoothly. And then we'll be opening for chat, the chat box. I will be managing it. And please allow us to record you because this webinar will be recorded. I'm Pierre Claver Kayumba. I'm a professor from the University of Rwanda, the College of Medicine and Health Sciences, a School of Pharmacy. But I'm working with the East African Community Center of Excellence for Vaccines, Immunization, and Health Supply Chain Management. I will be given an opportunity to talk a little bit more about our center. I'm currently coordinating trainings over there. We are having a master's training and professional short courses. But as an academician, I'm also supervising some PhD research works around immunization and health supply chain management and availability of health commodities. I will be pleased to co-moderate this webinar with Professor Bernadette. Over to you, Bernadette, for presentation
I think she sent a message. She may be struggling with some Wi-Fi issues. So let me just pick it from here a little bit and then introduce her first. Professor Bernadette is one of the global leaders. She is the president of European Public Health Association in the focus of migration and health. She is a medical doctor. She's on the Lancet Commission, and among various other, you can see her various degrees, diplomas, and the kind of work that she has done. In addition, she speaks about 10 different languages and surprising ones, including Mandarin, Norwegian, Hebrew, and of course, French, English, and 6 Indian languages. So she's both a medical doctor, a great researcher, and a public health professional. Next slide, please. Back to you, Prof.
Okay. Thank you very much, Paul, for introducing Bernadette. So as the co-host of this webinar, we are an East African Community Regional Center of Excellence for Vaccines, Immunization, and Health Supply Chain Management. As it can sound in our name, we have been created by the East African Community Council of Ministers of Health, and we are financially supported by German government through KfW. So since most of participants are coming from the East African community, you know that that decision that created us in 2014 created different centers of excellence to tackle different diseases in the region, and mainly strengthening tertiary education in our East African community. It is in that way they have created the Kidney Institute in Kenya, the Cardiovascular Institute in Tanzania, the Cancer Institute in Uganda, and for Rwanda, this Center for Vaccines and Immunization and Health Supply Chain Management, and the East African Community Regional Center of Excellence for e-health and biomedical engineering, and soon the East African Community Regional Center of Excellence in Institution will be created in Burundi. So we have conducted an assessment and saw that in our region, most of health professionals involved in supply chain are coming from different backgrounds with different levels of knowledge and skills. And then you have decided to create two arms programs, one being long-term program leading to a master's degree, and then short-term programs aiming at delivering short courses in different areas of health supply chain management. And we are also mandated to conduct research to be able to provide evidence for decision makers. As you may know, health supply chain is not recognized as a profession in our health system. So we are mandated to make it professionalized and recognized as a profession in our system. So far we have conducted a master's degree and have graduated already a first intake of 30 students from East African community and beyond, like Malawi and Sierra Leone. And now currently we are having an ongoing intake of 40 students from all East African community countries. Numbers are there. We have conducted a series of short courses around different topics in health supply chain management, different areas. The approach being that we always do a training of trainers to make sure that we have potential trainers in different countries And eventually we are decentralizing our trainings. If one day another you hear that you want to conduct a training in your respective country, it will be based on your needs, and it will be conducted by one of the members from the pool of trainers we have created. So we are extending our partnership with different organizations. You can see them there. And it's always a pleasure to open more, because supply chain involves a lot of stakeholders. And I will stop here. If there is any other question, I will be very happy to answer it through a chat, or we keep in touch through email. Over to you to introduce the co-hosts in Power School of Health.
Thank you very much, Professor Pierre. Good afternoon and good evening to all the participants online. And I can see that they're increasing by the minute. I'm going to introduce the Empower School of Health. And the Empower School of Health is a global organization that looks at transforming the way people learn, work, and save lives. We go to the next slide, please. Is somebody moving the slides?
Yes, I will do.
Yes, thank you so much. As time is short, I'm just going to give you some brief numbers about Empower's reach and impact. So Empower works in countries that stretch from Africa, including Eastern, Southern, Western Africa, Asia, and even to Russia and Ukraine and many more. And so there are over 100 countries that have been reached. And in these 100 countries or so, we have reached over 100,000 learners. And these learners come from very many different organizations, about 250 plus organizations that have been supported. And as you can see that the organizations include UN organizations, they include Ministry of Health, non-governmental organizations, and there's about 1 million hours of training that has been put in. What makes Empower unique is that Empower has both a multi-pronged approach and a cross-cutting approach. So the multi-pronged approach is about the team that includes leadership and change. It looks at public health and disease, experts from the areas, capacity building, digital learning and information experts, and supply chain and access to medicine experts. So this way of working is what makes Empower unique, is working across the sectors and with many disciplines together. And as you can see, Empower's funders and partners also include a wide range of organizations from the UN, academia, private sector, government sector, etc. Next slide, please. Next slide. Just a little brief overview, because it's difficult to go into details at this stage, but Empower has a number of online courses, and many of these courses will be interesting for many of you. And this is not an exhaustive list. This is just an idea of all the courses that are included within Empower's online courses. Includes global health procurement, international global health and supply chain, public health programs. And as you can see that while majority of the courses are in English, there are also some courses that are offered in French, Spanish, Russian, and English. There are certificate courses as well as postgraduate diplomas, and they're affiliated to universities and partners both in Africa, Asia, but also in the across in the United States as well as Europe. Next slide, please. Okay, so with that brief introduction of Empower, we've come to the first poll. This is to make sure that all our participants and the audience are also with us. So I would now ask you to join the poll, and you can see that the questions of the poll are very simple. And the first question is about your gender, the next one about your age, and the third one about the geographical region, the fourth one about your academic background, and where you work is the fifth question. So without much ado, I'm going to ask all of you to start polling. Is everybody aware how they're supposed to send in their answers?
Yeah, so let me just mention, could I launch poll? Let me just do this. Okay, can everyone see the poll? And if yes, you can please start completing it. We'll give you about 2 minutes. It's very easy to do. It shouldn't even take that long.
Excellent. And this is the most exciting part, where you see the answers from the poll coming in, and you'll see them changing as all of you are sending in your answers. And it looked like there were only male participants, but now we see that that's changing.
Bernadette, I think we're in the minority when it comes to over 50. I don't think we should emphasize that.
Okay, I'll stay away from that point. So,
all right.
If
East
anybody
African
has,
community, yes. Sorry, please go ahead.
Anybody having technical problems, please contact our team. They're, through chat, they'll be able to help you in case you're having some problems. But I think this should be very straightforward and simple for those who are tech savvy and for those who are not. So don't worry.
All right.
Okay. I hope everybody's had the opportunity to send that in.
Yeah, so we're sharing the results now. Bernadette, if you want to just walk through, and I'll scroll down.
Okay. So as we can see, we have 69% of our participants are men and 31% women. So we're not 50-50, but that's also good that we have, a fair amount of women participating. And we can see that age, we have a lot of young people, which is good. And as Paul wanted to emphasize, we don't want to really talk about the older people. This is meant for all of you who are young and promising. We're just promising now, not that we're not young. And then the geographical region, if you want to just take, I can also scroll down. And we can see that the majority, 53%, are from East Africa, which is great, because we also have our hosts, and we have Southern Africa 5%, West Africa 9%, Central Africa 5%. And we also have people from Asia and the Pacific, 20%. That's great. And of course, we don't expect a lot of people from, as this was intended to be, focusing on Africa. We're glad that there are a lot of people from Africa. And then let's look at academic background. Not surprising again, 61% have a background in pharmacy, and then followed by management and engineering, which is 19%, which is also very good. And then it's equally divided between nursing, other, and medicine, dentistry. And also, and this is also very important, that where people work, we see that a lot of people from ministries of health and other government bodies, 47%, that's excellent. We have also a fair amount from international NGOs, 16%, and 16% from the private sector. And so that's a very good distribution of people from the different sectors. So very pleased that people from different sectors are participating, and I hope that that also makes the discussion really interesting. Okay, should we stop sharing the results? Yeah.
Thank you very much. So let me now share my screen. And that would, so Professor Kayumba, thank you. Let me, actually, no, there's still, sorry, it's back to Professor Kayumba. Yeah, please keep going, but I'll just share the, Professor Kayumba, please continue talking about this.
Thank you very much.
Yeah, please go ahead.
Yes, thank you very much. It is raining in Rwanda. Hopefully you will not be disturbed by the rain. I will try to shout as an academician. So Dr. Stephen, Dr. Stephen has been called for other responsibilities, but he's the director of our Center of Excellence. He's a health economics, and so he served our ministries of health in different positions at East African Community and South Sudan and the other East African Community countries. Unfortunately, he has been called for other responsibilities by the University of Rwanda. He couldn't join us today, but you will always hear from him when it comes to management of this Center of Excellence for Vaccines, Immunization, and Health Supply Chain Management. I will introduce the second panelist. It is, Paul, it is very difficult to describe you, but I will try my best to do it. As people can see you, you are not that person who remembers when he has graduated, but since we are having an academic event, you will allow me to say that you have graduated in 1986 as a pharmacist from the University of Wisconsin-Madison. And you did your master's in business administration in Northwestern University, Kellogg School of Management in Illinois. So you have done a lot with, within those 25 years that are screened there as a consultant with WHO, as a project director with MSH, aiming at public health, supply chain, and access to medicine. You have been also head of supply chain management with the Global Fund, and you are currently the Dean and the Director of the Empower School of Health, 11 years now. And last not the least, you are the Vice Chair of the Board of Directors at People That Deliver. Those who do not know what People That Deliver is, it aims at improving and equipping health supply chain workforce in order to optimize health outcomes by improving access to health commodities. You will take us through the presentation, and obviously we'll get to know more during the presentation, and it will always be a pleasure if there is any other question concerning you as person or you as expert. I will share it at the end of the presentation. Thank you very much. The floor is yours, Paul.
Thank you. Why don't we introduce Andy and Sachin later on, Bernadette, when they start to speak, if that's okay, so that we can jump to the technical content now. Professor Kayumba, thank you for a very generous introduction. It was both long and embarrassing, and if my skin was any fairer, you would be able to see my colors change a little bit. But thank you. So what I'd like to do is to provide the introduction, the foundation for the next two speakers to continue on, and that is related to supply chain challenges during pandemics, which is affecting not only our the existing supply chains, which are creating some incredible delays when it comes to all other public health programs, and the COVID challenges themselves, trying to respond to that today, and then planning for the COVID-related devices, diagnostics, and medicines that are in the pipeline and will be introduced into the countries. So it's challenges upon challenges, as you would imagine that you're already experiencing. We'll quickly run through poll 2 And what this will do is give us a sense from a technical point of view, what is your understanding in this particular area? Let me do the, how do we go to poll number 2? Could I, how do we close this one? Let me see if we can now. No, it keeps coming up poll 1. Could I ask somebody else in admin to launch poll 2? Yes, okay. So here are the questions. Hopefully you can see them, and please make sure it runs for about 2 minutes. Are you currently involved in the COVID-19 response? Is the first question. Second question is, do you have any training or education in operations management or supply chain? And the third one, do you have any previous experience of managing supply chains in health emergencies? So that's the emphasis. And the last one, are you aware of the WHO COVID Emergency Global Supplies Catalog? Okay, just a few more votes coming in. All right, we have almost 70% have voted. So let me respond to these results, okay? Can you see my screen? Are you, can somebody tell me if they can see the results on my screen?
Yes, we can see the results.
Great. So first of all, are you currently involved in COVID-19, fully dedicated, indirectly or partly involved, and not involved? We see that there's at least 1/4 of you that are fully dedicated, which means some of the points that we'll be sharing would be extremely useful for you, and chances are you already know about them. Indirectly or partly involved, which is the majority of you, 64%, 2/3 of you, and another 15% not involved anyway. That's at least for today. And do you have any training or education in supply chain or operations management? About 12% have none, 50% have some, and at least 1/3 of you have quite a lot, which means you could actually do these trainings with us next time when we do it for other regions. Good to know. Number 3, do you have any previous experience? About half and half in terms of managing health supply chain emergencies. This is a very high number, by the way, so kudos, because when we did this in across Asia, 11 countries with WHO CRO, that number was quite low, and we've done it in other countries as well. That number has been low. So the fact that you have health emergency supply chain experience, especially in today's circumstances, that is excellent. And about the supply chain catalog, that's at least we see 10% who know about it and have used it for ordering. That's good. Another 50% or practically 90% know about it but have not used it. So we'll talk about several different catalogs that are actually out there that we'll talk about, which can be extremely useful for you. So quickly go back to sharing the full screen and tell me if you see my full screen. Can you see the slides okay now?
Yeah, go ahead.
Yep. All right. So in terms of timeline, so this is a really interesting chart. What this tells us is that over the past 2 decades, and this is just covering about 20 years, there have been plenty of different types of pandemics, whether it's MERS, cholera, SARS, either pandemics or epidemics, Ebola, H1N1, and you can see when they started. And each time we've had some sort of an emergency, there's been a global response or a regional response from different organizations or groups of organizations. And this upper part talks about yellow fever, Zika, Ebola, H1N1, etc. And here from 2000 onwards, you can see the different responses by Gavi, or the Global Outbreak Alert Response Network, which is hosted by WHO, and we are working closely with them, and various other institutions and groups, international health regulations, pandemic influenza preparedness, etc. So it's no surprise that there have been pandemics and more were expected. Now, in terms of where we are today and what's actually been out there in the previous pandemics, you've all heard about the Spanish flu about 102 years ago, and the number of deaths it's created it was responsible for. The estimates are 40 to 50 million, one of the biggest ones there. HIV/AIDS, 25 to 35 million since 1981. And some smaller ones, Asian flu, Hong Kong flu, swine flu, etc. We're at COVID here. This we had developed in May. This chart was presented in May 2020, and that number was 324,000 deaths. Today, towards the end of August, we are at 800,000 deaths, over 800,000, with 24 million confirmed cases. And because the focus of many of the participants, and this was about East African community, I wanted to share those numbers. And for multiple different reasons, these numbers are low compared to the rest of the world. Interestingly, the deaths are less than 1,000 across these countries, across 6 countries of the East African community, and confirmed cases are 42,000. Some of the reasons are that you've taken action, you've had your lockdowns early before the spread of the virus. It could be underreporting of cases for sure, as it is in many other countries as well. So it could be a host of reasons, but these are the best numbers that are available today. Regardless, the numbers are increasing, they're growing, and they're likely to increase over the next, definitely this year, but over the next, most likely next couple of years until we have vaccine and treatments in place. So the importance of supply chain in all this, it's no surprise, but what is important to emphasize is that the capability, the capacity, and the response of the supply chains can have a direct influence on the duration of an epidemic, both in terms of being able to respond to it and being able to ensure that we can address all the different challenges that we are experiencing, and we'll talk about that later on as well. The stronger the supply chain, the potential to shrink the epidemic. As we know, the supply chains are no longer national or even regional, they are global. And even though you're sitting in a particular country, your knowledge of what is happening at the global level, at the policy level, at your regional level, and at your country level is extremely important. Unfortunately, as we've moved forward over the past decade and 2 decades, public and private sector have focused on efficiency in supply chains as opposed to resilience. And there are 2 different objectives, and they create 2 different processes in terms of how you would be able to respond to a particular situation. Efficiency also creates a brittle supply chain. When we say efficiency, you're typically looking for fewer suppliers. You're looking for aggregating different manufacturers. You're looking for volume discounts. You're looking for speed. You're not necessarily looking for diversity. And there's a price to pay. So you can't be both efficient and resilient. And the idea is, if you are on the efficient side, when everything is working well, you'll be okay. But when you have a pandemic or a crisis the way we are having right now, a resilient supply chain responds better. So the idea is, how do you balance? You can't be too far between one and the other. So the idea is, how do you balance the 2 priority areas? And it has impact on funding, it has impact on speed, it has an impact on results as well. And it's a really interesting article. You can read more about this as well, and we'll be sharing all these links. We'll give you a specific example when we talk about a brittle supply chain. And we're all suffering right now, and we'll give you specific examples here. So dependence of manufacturing industry on a few sources of raw materials. We know that depending on the various countries, there are as many as 65,000 to 100,000 different pharmaceutical products. A typical country in Africa, let's say a 50 million population country, would have anywhere from 10,000 to 30,000 different product categories. What's interesting, and bigger countries have more. India has, for example, more than 100,000 different products. But what's interesting is that there are very few and limited sources of raw material suppliers globally. And China obviously produces a lot of the API. India, API is in pharmaceutical raw materials. And India relies on the Chinese manufacturing. And India is a powerhouse in finished pharmaceutical products. So here we have a situation where India produces a lot of products that are exported to, not just to Africa, but across the United States and Europe. And you'll see the last point here that the US FDA is also experiencing a tremendous shortage of medicines. But what is even more fascinating is that the capital where the epicenter of the outbreak of coronavirus is also, which is in the city of Wuhan, in Hubei province, is also the capital of manufacturing of intermediates and raw materials as well. So you can imagine the impact this has had on the supply chains of pharmaceuticals. So the potential sources of information on procurement and supply chain management, how does one sitting in a country with not too much access to all this knowledge and information, which is changing on a regular basis, how would you manage? What can you do? So we've aggregated some extremely useful sources that you could rely on. First of all, the COVID-19 Supply Chain Task Force. It's led by WHO and the World Food Program, and its goal is to make supplies available to everyone where they are needed. And there's a WHO catalog, there's a UNICEF catalog, and the WHO forecasting tool. All of these will be discussed in more detail by both Professor Andy and Sachin. There's also the WHO access to COVID-19 tools as more and more. So the next challenge is on its way as well. As soon as more vaccines and drugs are available, how do we ensure equity in accessing these products, which will not be in sufficient quantity to address everybody's needs? And this takes me back to the time when I was at the Global Fund and we were moving from chloroquine to ACTs for malaria, and we only had one manufacturer, and Novartis was not able to produce enough for the entire number of 300 million cases at the time, and they could only produce 20 million doses. So it'll be a similar situation when a vaccine or a drug comes out. How do you equitably distribute, say, 20 million doses or 100 million doses, but the requirement is in 10 times that? Global Fund has also put out there information about how its grantees can use some of its funds and also use their procurement platform for accessing these products. We are working with multiple countries and the WHO to build capacity rapidly so countries can make the right decisions and the individuals are fully informed of the different resources. Global associations like People That Deliver and IAPHL, which stands for the International Association of Public Health Logisticians, are also sources of knowledge for all of you. With that, I give the floor to Andy, but just before you jump in, Andy, Bernadette, are you able to quickly introduce Andy to the participants?
Absolutely. So it's a great pleasure to introduce our next speaker, Professor Andy, who actually doesn't need an introduction to everybody who works in this field. He is a professor in public health and is also the head director of training at the Empower School of Health. He's a co-author of the book, co-author of the Yellow Book. And the Yellow Book is an important book for those wanting to really understand how supply, global supply, and medical supplies and pharmaceuticals and vaccines all work together. And his over 25 years of experience and expertise in this particular field makes him the ideal person to talk about the current situation of global COVID-19 supply chains. So over to you, Professor Andy.
Okay. Okay, let's try and go to full screen here. Okay.
Andy, would you like to share your screen or do I continue sharing for you? What would you like?
I'm trying to share, but if you've got share screen up, then fine.
Yep, it's up. Why don't you take it from here and just tell me when to switch?
Okay. I don't see it displayed on my screen. Okay.
Do you, Bernadette, can you see my screen with COVID-19 commodity availability?
Yes, I can see it.
Yes, we can see your screen.
Okay, then I'll follow along on mine then. Okay. Okay, so we go to the next slide, please. Slide 29 on availability PPE. Okay.
Yep.
Personal protective equipment. For PPE, demand is far outstripping supply. And there is a massive demand which is just not being met. We're talking about a 1,000-fold increase in the demand. The WHO supply portal is talking about millions upon millions of different items required: face masks, goggles, gowns, shields, all across the board. It is a huge change. And for many countries, it's a change which they've not done before. Not all countries were using this amount of disposable equipment. Many of the surgical gowns and surgical masks were reusable. Now we're looking at a huge quantity of disposable, and it's a massive struggle to try and cope with that. Next slide, please. Okay. So it's very much a supplier's market. And unfortunately, the short supply situation is driving massive competition among the buyers. And that means the high-income countries are bidding among themselves for the supplies which are available. The US is bidding against Europe, France is bidding against Germany, which means for low and middle-income countries, it's exceedingly difficult to get the supplies, and prices are increasing daily. The price increase is unprecedented across the board. Manufacturers and sellers are demanding advance payments. They will not supply without a 100% advance payment. How many public sector procurement systems can provide advance payments? It's a real difficulty. Even when you provide the advance payments, many suppliers are cancelling the contract because they found another buyer who will pay an even higher price than you agreed. It's a free-for-all market. It's also full of counterfeit and substandard products. Even those countries with stringent regulatory authorities, with a high degree of control, such as the UK, bought 400,000 gowns which were substandard. Germany and Denmark tried to buy test kits from a company which didn't exist, and they made advance payments. Interpol is following the case. It was an internet scam. So it's an exceedingly difficult situation around COVID commodity procurement. Next slide, please. However, the major bottleneck is not actually manufacturing. There is not enough manufacturing, but the greater challenge is that the materials which have been manufactured can't be moved because of the reduction in air freight capacity. Massive reduction. It's exceedingly difficult to transport the materials which are available, and it's especially difficult to Africa because there are so few cargo flights coming into Africa. Fortunately, sea freight is not heavily affected. Rates have not increased greatly, but there has been major increases, and we're talking about 100 to 300% increase in air freight rates. There is a massive backlog of freight to move. The cargo requirement is huge. Next slide, please. What commodities do you actually need? 50% of you on the polls showed you were pharmacists. They don't teach you very much about the specification for face masks in pharmacy school. So, fortunately, a number of catalogues and specifications have been made for you. There is the WHO Emergency Global Chain System Catalogue, but 50% of you had never heard of it. There are links to all these items at the end of the presentation. So there's a full catalogue of the COVID items. There's a separate list for the medical equipment. In the quantification tool, which Dr. Sachin will talk about shortly, there's the list of essential medicines you need. COVID patients also get bacterial infections, which need antibiotic treatment. There are controlled medicines. Many of the COVID patients will be in pain and need pain relief. There are cold chain items to supply as well. Those are contained inside the quantification tool, and you'll see some lists of those shortly. I see a note up. Are you going to get the slides? Yes, everyone gets the slides. Next slide, please. This is a sample of the WHO Global Supplies Emergency Catalogue. You can see the item. There's an indicative price. Of course, prices are a major problem. They're changing rapidly, but at least you can have a price to prepare a budget. That's available online. It's free to download. The links are at the end in the slides. Next slide, please. There is also the Global Fund Personal Protective Equipment Catalogue. Those countries which already have a Global Fund grant may be familiar with the Global Fund online ordering system of WAMBO, which is for ARVs, TB, and malaria products. That's been expanded. There is now a PPE catalogue available in that procurement system as well. Global Fund has made a facility for countries to reprogram part of their grants, and there's a little extra money available as well to assist in PPE. This catalogue is also linked with the UNICEF catalogue. You can see the UNICEF material numbers there. Again, all the links are on screen and provided in the slides at the end. Additionally is the UNICEF technical standards, detailed standards for each of the items. So there is a lot of information being provided by different agencies. WHO, UNICEF, Global Fund have put together details on the different commodities that are required. Next slide, please. Okay, into forecasting for health emergencies in general. Next slide, please. Okay, can we go to polling now? Can someone activate poll 3, please? Okay, so have you been involved in the forecasting and procurement of PPE? What is your exposure to the COVID essential supplies forecasting tool? And finally, have you received any training in the WHO COVID essential supplies forecasting tool? If you could vote now, please. So this is forecasting of PPE, personal protective equipment.
I don't see any voting happening. I wonder what the issue is.
The poll is not active on our side.
Yep. Yeah, now it is.
Yeah.
Please
Okay,
continue.
here we go.
Oh, somebody closed the poll. Sorry, please restart that. Restart poll 3. Yeah, I think there's a delay between hosting it and people receiving it. All right, poll 3 has resumed. If you could please vote again, everybody. There we go. Yep, that's good. Sorry, not sure. Did the polling stop again?
It looks like it, yeah, but okay, we'll take it
Let me
from
just-
there. Okay.
Let me just share what we did get, okay? About half the people voted. Sorry, it ended too soon. But let's, Andy, if you want to just read out the results.
Okay, so involved in forecasting, it looks like about 30% are involved. Some are doing procurement, some are doing other issues. Okay, of PPE. Never heard about the forecasting tool, half. So a lot of work has gone into developing this forecasting tool, and yet the socialization appears not to be getting out there to be with it.
Yeah, and that's,
the-
so just to emphasize, this is, we have WHO and CHI that helped co-develop this, spent a lot of time developing it, but they realized that they have not invested enough time in socializing and ensuring people are using it or even know about this. So it's a problem that WHO realizes, and they're trying to fix it in multiple different ways, and this is one of the different solutions. So not unusual. Please go ahead.
Okay, so training in the essential tools, most people know, just 18% have had some training. And of course, everybody wants training in the tool. Okay.
Yeah.
Who should
And
be
last
part
one.
of the forecasting team? Oh, the pharmacists seem to be very keen on being in there, but a full mix across the board, I think. Yeah.
Yep, indeed. Back to you.
Okay.
Let me
So
stop
next slide,
sharing.
please.
Yeah.
Okay, so in quantification for health emergencies, it's a mixture of the arts and the science. We often do quite complex calculations, but then we adjust them based on experience. Unfortunately, none of us has that much experience in COVID commodity supply. We don't have the experience, the art element, to be able to adjust the figures. And that's normal in health emergencies. So all quantifications are only ever an estimate. But for COVID, our estimates cannot be tempered by judgment because we don't have that experience. So the situation becomes far more one of risk management. And it's important that we engage risk management tools into the act of quantification and managing our commodity supplies. Next slide, please. There are a whole range of supply chain risks. For COVID, it appears we have nearly all of them. And normally we can apply proven mitigation strategies to reduce the risk element. But that's difficult in our current situation. One of our strategies is to have buffer stock. But at the moment, it's difficult to get any stock at all. So it's very hard to establish that buffer stock. Lessons for the future here, that we're going to need stockpiles regionally, globally for the future to be able to respond to epidemics like this. Bringing that risk management approach helps us to manage the situation and categorize and measure the major risks and how we can hope to mitigate against them. Next slide, please. Okay, I hand over to Sachin now.
And just before Sachin jumps in, Benedette, do you want to please introduce Sachin?
Absolutely, and I also want to thank Professor Andy for taking us through that about the current situation with supply for COVID-19. The next speaker, Sachin, needs also no introduction. He is the head of supply chain practice at the Empower School of Health. He has over 15 years of experience and expertise in procurement and supply chain. And in particular, his area of expertise is quantification and forecasting. And that's exactly what he is going to talk about. How much is required? Over to you, Sachin. The floor is yours.
Okay. Thank you, Bernadette. I'm just trying to share my screen. Just a moment. So,
all right, let me stop mine.
Okay. So,
yep, we can see your screen.
Okay. Can you see the slide title, Tool Uses a Mobility-Based Quantification?
Yes.
Yes.
Go ahead.
Okay. So first of all, thank you, Professor Andy, for giving that primer on COVID forecasting and supply chain. So friends, we saw that the different kinds of commodities that we need to tackle COVID. Now, the next obvious question is, we know what commodities we need. So the next question is how much, right? And that is where, of course, forecasting and quantification comes in. So the next very important step in the overall supply chain management. And usually, or not usually, I would say always, we have one of three options, modeling options, when we try to do quantification of any health commodity. So one option is that we use consumption data of different commodities for the past very many years. We typically have an established trend, and we use some sort of time series forecasting to project into the future. But is that possible in case of COVID? Of course not. Nobody had even dreamt that we would have COVID, 8 months ago. So we don't have any past consumption data, right? In the absence of past consumption data for any new pandemic, the other option is, to look at a similar set of commodities or a similar disease in a different area, for example, right? Now, again, we never have had anything like COVID before, right? Ebola, MERS, SARS, they're very different pandemics. So there is no way of using an adjusted or a proxy consumption-based model for using consumption data of other commodities. So what we are left with by default is a morbidity-based method. And here, what we typically do is we look at the incidence of the disease, the population, and we look at the various treatment protocols that, if we have these many kind of cases, how do we forecast, right? So basically all tools that you have, that you will come across right now, whether it's a very quick and dirty Excel-based tool or a more advanced tool, which we'll talk about shortly, they'll be using this mobility-based method. Sorry, what happened? Okay. And one such tool is the WHO Essential Supplies Forecasting Tool 2.0. Now, why do we need a tool, of course? Because like you saw, there are so many different commodities. In fact, this tool has about 60 plus commodities across 6 different categories. You have got PPEs, you have got equipment such as ventilators, oximeters, you've got medicines, you've got hygiene supplies like hand rubs, soaps, you've got consumables. So there are, different types of supplies and, different needs for severe patients. So that's why it's too complicated for you to do on an Excel, although you can do it. And that's why the need for a tool. And the premier tool in use right now across the world, although 50% of you haven't heard about it, is the WHO Essential Supplies Forecasting Tools, right? And what this tool has is that, it takes a large array of data. So, you will have data, as you can see, the various sections you have got in this tool. You first select the country, then you enter the current cumulative case count, and then there's a whole host of information from patient case severity, healthcare workers and staff, hospital infrastructure, labs and testing, oxygen use, equipment use. So it has got a comprehensive set of inputs. And the kind of information is, of course, like how many cases are there, what is the ratio between mild, moderate, severe, critical cases. It also, very interestingly and importantly, it takes in a lot of supply side information, like how much staff you have, how many beds. So one very good feature about this tool is that, it will forecast based on what your limitation is. So if you don't have, so many hospital beds. It will not, or healthcare workers, it will put a cap on how much PPE you need. And similarly, if you have a limited number of gene expert machines, it will limit a cap. It will put a cap on how much of diagnostic tests that you would need, right? So going to the next slide, I just sort of summarize this this tool for you. And so this tool, right now we have the version 2 of this tool. It is easily available on the WHO website. A Google search, the first, or WHO ESFT, the first result will take you there, or you can go to the WHO site and search. The latest version was released in April, but you will keep getting newer versions with more features and more functionalities. The short term, so this tool gives you short-term forecast, right? And that's logical, because even the best of epidemiologists can't really forecast very accurately few months down the line. So the idea is you forecast in the short term, you procure in the short term, so you buy more frequently in smaller quantities, and that way you'll be more accurate. So it is morbidity based, so it of course takes overall patient numbers. Now, in terms of modeling, this is not an epidemiological estimation tool, right? Best use of this tool is if you have an epidemiologist and you get the numbers which are entered in this tool. In the absence of which, this tool does help you with some sort of case estimation. So there's an exponential growth model. So a country like South Africa or India, where you are experiencing steep exponential growth, can possibly use, you need to enter inputs such as doubling rate, and you will get an estimate of cases. There's another susceptible infectious removed model, which is more applicable to countries in the mature stage of the pandemic, say some country like Italy, where you have a large number of recovered and infectious cases, and you also have a sero survey data about susceptible cases, right? But mostly advisable is to have a good epidemiologist in your forecasting team and put in those numbers, right? We already mentioned the large number of inputs and assumptions with patients, equipment, staffing, and so on. But one important thing is that this tool, although it might appear complex, but you can also use this tool with two very simple inputs, which is what country you are and what is your number of current cumulative cases. The tool actually comes pre-populated with a lot of reference data from World Bank, UN, WHO websites, and a lot of standard, the treatment guidelines which are released by WHO. So all those reference values can be automatically input in the tool at a click of a button, or you can view them and then, which is more advisable, and enter either those values or more updated values that you may have. Right, so that is basically an overview of the tool. This is how the tool looks like. So the tool has about 14 tabs, but the most important tabs are the first three. So the first tab, the tool overview, if you see at the bottom, this tab will give you some basic information about the tool, how to use it, and with that and with some bit of training or with some bit of experience, most people will be able to use, you all can use this tool, right? And then there is the input tab, where you'll probably have about 55 inputs, but like I said, you can also do with just 2 inputs. And then there's a dashboard. So the most important part, where you get all the results. Here also there are a few inputs, like you can select or enter the testing strategy, the model epidemiology, or the case estimation model. And then you get a whole set of outputs, which I'll just take you through, right? So the other tabs over here are basically just, summary of staff, summary of the various outputs in more detail, and also the reference values and inputs. For an advanced user, you need to go there. Otherwise, you stop at the first 3 or 4 blue tabs. Okay. So here's just a sample of the medicines. Now, what the tool does is, and these are, like Professor Andy mentioned, these are for supportive treatment. There's of course no treatment yet for COVID, and mostly, painkillers, antibiotics. These are for supportive treatment. So there are bundles of these which are there, and which you can order. More advanced users can also make some adjustments to these. Another example I like to share is that for PPE equipment. And here you can see that, while you also can see the different kinds of items, the way it calculates is, all the inputs that you would give of how much staff you have, it will use that, and it will use the ratios of usage to calculate the total amount of gowns or masks that you would need, right? So that's an example of PPE. And now coming to the outputs, so the tool will, do all the calculations, magic will happen, and then you will see all these beautiful graphs and outputs. So of course, the most important output is that you will get a plain old list of all the items, 60 plus items, and the quantities that you would need for the forecast period and all that you selected. But you will also get some very nice visualization. So here, for example, you can see there's a visualization of week-wise number of cases, and also a breakup of, between critical, severe, moderate cases, mild cases, right? Similarly, you will not just get the output in quantity, but you will also get in terms of budget. So across all the 6 different subcategories, PPEs, hygiene products, diagnostics, consumables, equipment is oximeters and ventilators and so on. And of course, the consumables. So all this, you can also see the budget. So if you're short on budget, you can probably go back to the tool, tweak the inputs, or just while placing your order, you can prioritize one over the other. And like I said, you in both terms of values and units, you will get all the outputs for the different commodities in terms of pure quantification. Right. So that is a quick overview of the tool. And before that, of course, my colleagues have talked about the various aspects of COVID supply chain. There are more resources available from, there are a few resources available from WHO, the logistics pillars, the partner platform preparedness and response. There is also available on YouTube a larger in-depth training on the ESFT tool. There is some material available from commodities as well on the essential role of health supply chain workers in the COVID-19 pandemic. These are some general resources, and of course, you have Empower School of Health, University of Rwanda, the EAC Center. So we are also, of course, there to give you, curated or customized and tailored help. So with that, I come to the end of my section, and I will hand over the platform back to the moderators. Thank you very much.
Thank you so much, Sachin, for that. Very useful and in talk, and also giving us all the information that I can see we've received. We're now ready for the fourth poll. Is that right?
Bernadette, let's do the fourth poll after we've been through the Q&A.
Okay. All right.
So
then we need to take that one down.
Yeah.
Okay. All right. So we have one question that came up in the chat, and I think that that question is an interesting question related to Sachin's talk. And the question was from Nirakanta Boy. The question was, looking at the spike in COVID-19 cases and the disease pattern and the fact that the cases are underreported, poorly reported due to lack of testing, how rationally can a resource-limited country forecast the PPEs? So, Sachin, would you take that question, please?
Yeah, yes, thank you, Neil, and thank you, Bernadette. So, very, very good question. So, there is always a question on the data which is being reported. Sometimes there is a problem in, the number. Sometimes there's a delay in reporting as well, right? So that's why I said, so there are two things. One is that this tool can also be used for different scenarios, right? So one thing is to use the tool, enter the number as of data that you have. The other is to enter, different numbers. So for example, if you're trying to prepare for 2 months ahead, you can probably use estimated numbers. And I think it's very important to have epidemiologists and other, health experts who are into this pandemic. So what they can do is they can give you a better sense of numbers, or they can help you to draw different scenarios. And then that way, you can probably improve the output of your forecast. So doesn't mean that, you challenge the numbers officially, but, behind closed doors, if experts have some sense of the real numbers, and you can input them and draw different scenarios.
Thank you so much, Sachin. We had one question earlier on, which I think is a question for Professor Paul, and the question is, are sustainability and resilience interchangeable?
Do you want me to take it? Or,
Go for it, Andy. We've discussed that. Yes, please go ahead.
The simple answer is no. Okay, they are interlinked, but they are not interchangeable. Resilience is different to sustainability. Resilience means that disruptions that occur, you can cope with. Sustainability means that you've got a longer term supply. So resilience is an element of sustainability, but it is only an element. For sustainability, you need a lot more than just resilience. The first step in our supply chain is to come back to resilience, because for the last 10 years, the whole focus has been towards efficiency, and we have sacrificed resilience, and we are now paying the price for that sacrifice. The COVID commodities we've talked about, okay, that's for COVID. But our regular supply chain commodities, our normal painkillers, our normal antibiotics, they are being disrupted as well by this pandemic because our supply chain is not resilient. Sustainability will come longer term. Okay, I'll leave it there for now.
Thank you so much, Andy.
Let me just add one more thing, which is really significant. And this is something that the African continent has been positioning itself with donors, with investors, and that is to explore manufacturing in the continent of Africa. Just to give you a sense of numbers, the total number of manufacturers across the entire continent of Africa are less than 1,000. India has approximately 10,000 manufacturers. China has about 4,000 manufacturers, okay? And there's been a push to explore if, again, this was for pharmaceuticals. Obviously, in a situation like this, it's impossible to have multiple manufacturers for everything, but the whole idea of diversifying risk, improving resilience, this is one of the areas that's being discussed, but hasn't moved forward because the argument was always, no, it's far cheaper to get it from either India or China, or if it is a more it's a very technologically sophisticated product, it's possibly Europe or US. They understand the difference and this movement, and hopefully as things calm down a bit, the African Union has been promoting for local manufacturing or African-based manufacturing. And for some products, this may indeed be an area of focus going forward. So that's, again, an example of discussion on resilience, but because of efficiency, it was dropped or it wasn't really pushed forward. Back to you, Bernadette.
Yeah, thank you so much, Paul. What I'm going to do now is I'm going to read 2 or 3 questions because we have a lot of questions that have come in. And then if you could answer them one by one. So the one question from Francis Abura is, there is an aspect of limited resources to procure COVID logistics. How do you balance the lack of resources and the actual demand for commodities? And the next question from David Brown is, how does one deal with the potential of a forecast with suppliers? I'm just trying to read it. With suppliers who have secured higher volumes where they are now no longer right. The patient projection has come down significantly in South Africa versus earlier projections. So maybe you could take those 2 questions. Andy, are you going to respond to them?
Yeah, okay, if I take limited resources.
Yes.
Okay. If I take limited resources first then, okay. For many countries, the absorption capacity is not there. So even you have limited resources, the reality is you probably couldn't absorb a lot more. You don't have the ICU beds. How many ventilators can you use without all the support? So we talked about the forecasting tool being capped because it won't allow you to order more than you can use. And that's one of the features. Countries think they need a lot. Their absorption capacity is often low because they don't have the infrastructure to support more. That's one moderating factor around limited resources. Everyone is struggling with resources at the moment. There is not enough funding. There's not enough materials available. But how much could you actually absorb? Okay. The other question around higher volumes, I think if you've ordered more than you need, I know lots of countries that will gladly take the supplies from you, starting with the whole WHO supply mechanism. They would love to have supplies from you if you've ordered too much. Okay.
Thank you so much, Andy. The next two questions are also along the same lines. It is Ilya Martin, and the question is, how long shall we continue to be in this supply chain limbo due to COVID? What is the way out? And a related question from Etienne is, the shortage of COVID-19 health commodities, especially for Africa, is not due to the capacity of manufacturers, but also an issue of limited number of cargo flights. How can we tackle this issue? So if you could please respond to those questions.
Okay, we'll take, how long is it going to last? I'm afraid I will have to read the tea leaves and look in the crystal ball. Nobody knows. But what we're saying so far, the best predictions of the old and the grey, is that it will be all of this year. We expect the situation to start easing early next year. But manufacturing still cannot even approach the demand at present. So for all of this year, certainly, probably into the first quarter of next year. Cargo flights are starting to improve in Africa. One of the points around this is many of the passenger flights carried cargo. They took what they call belly hold on the planes. Those passenger flights aren't there, and they're not coming back quickly. So it's a case of gearing up the cargo flights. Turkish Airlines in particular are now gearing up flights into Africa. We are seeing some easing of the situation. It is expected to improve as we go through the year. There's more charter cargo flights coming on. But passenger resumption is not likely to come within the next 2 years, and they had a significant cargo carrying capacity. That's lost to us. So I have hope for the future. It will improve. Sorry, Paul.
Yeah, no, thanks, Andy. Let me just add a couple more points and also ask Sachin if you'd like to add something as well. On the question on limited resources, lack of resources, even the rich countries, even the United States, as you would have read in the news, is struggling to get enough financial resources. They put in $1 trillion package to address COVID, which was then asked to make it into 2 trillion and 3 trillion, and some of it for health, some of it was for healthcare commodities. Anytime there are limited resources, and the lessons that we've learned, and we were already in a limited resource environment before COVID, and the focus has to be a risk-based approach that Andy talked about earlier. Which are the patients that are highest at risk of contracting and dying? We know who they are. We know it's comorbidity, patients with comorbidities, it's the elderly, and those are the lives that need to be saved. There was a presentation that I had observed was Tom Frieden presenting, and there's a fascinating slide that he showed, which tells a lot. If we look at, and we've all seen the percent death rates, and we know that for the elderly and for people with comorbidity, the death rate is higher, the mortality rate is higher. But then if we take the average death rate, so it's 25 million cases and 800,000 deaths approximately based on confirmed cases. If we fragment those deaths and look at it from people under 20, 20 to 30, 32 at different age bands, and within them, if you look at those with morbidity, what's clear is the youngsters, for the youngsters, this is no worse than a flu that we would experience, a cold that we get on a regular basis. Whereas on the higher end, for the elderly and with comorbidities, it's much, much worse, and it is quite fatal. So when you have limited resources, protect those who are in danger of dying, and that's what you have to do. So get those resources appropriately. When you talked about the supply chain limbo, for this year, for sure, that's going to continue. But they're expecting, based on, again, reading the tea leaves and forecasting, etc., that there would be a second wave of infections as you start to open up, as you start to open up your economy, as you start to move around more freely, or you get frustrated from being locked down and wearing masks and what have you. There will be another wave. But while these waves keep happening, we know that there are attempts being made for treatments, for cures, for vaccines, and it's a race between the response to this virus, and on the other side, the virus mutating or coming back again in different forms as we start to open up and reduce our physical distancing as well. Right? But Sachin, did you want to add anything on the question so far, or do we take a couple more?
I think you and Professor Andy covered everything. So we can...
All right, thank you.
Sachin, there's a couple of questions that you might just want to answer on the chat, on the tool. So I would also suggest to colleagues that you all can see the questions on the chat, and if there are simple questions, please try to answer them on the chat as well. Okay, I'm going to read out the next couple of questions. And Roger has a question: how do you think that we can cope with export restrictions affecting supply chain management for some countries during this COVID-19 pandemic? And another question that says, most PPE, including gloves, are bulky. Not sure if there's a regional glove manufacturer in East Africa. How can we bring economy of scale? And Mohammed Ali says, there was an issue of substandard test kit and PPE, which finds itself into the market of all places that developed countries. How will be our situation where what we receive is more of donation, the procurement we are making? Why can't we have standard post-market surveillance, even if the situation is not expected to reduce more risk? I think maybe you all can address those three questions, and we'll go to the next block.
Okay, if I take the export permissions, always a problem. In COVID times, it's worse. That there's no simple solution to it. We just have to work as best we can on the export restrictions. Gloves, the problem around gloves is we talked about this resilience in the supply chain. Although there are thousands of glove manufacturers around the world, 90% of the rubber for surgical gloves comes from Malaysia. You can't transport the raw materials to the glove manufacturers to get the gloves made. Just as we had with the API, the active pharmaceutical ingredient, most of the manufacturers were in China. They've got to get it to India. The finished pharmaceutical product, we have exactly the same problem on all the latex items. The raw materials is limited because we've gone for efficiency and not resilience in our supply chains. Substandard, it's buyer beware. What's available? There is the WHO mechanism. There's the Global Fund mechanism. There's the UNICEF mechanism. It's 3 different procurement mechanisms to help you to source reliable, quality assured products. If you're going to buy independently on the open market, buyer beware. It's exceedingly difficult. You have to go through one of the systems. The WHO system is particularly good at ensuring quality. Okay, Paul, you want to add to that, or? You muted.
Yeah, thank you. There's one more point to add, which is tangentially related as well. One is looking at supply capacity. The other discussion I was having today with a potential supplier is testing capacity. Now, we've got, for COVID testing, the PCR machines, that demand, again, outstrips the supply in terms of being able to do these tests. And these machines are manufactured by by Abbott, Roche, and there may be a few others as well. But it's not just an issue of equipment, it's setting up the systems and processes and getting the tests done, which are quite expensive, as you would have known, depending on the country that you're in. We received a request from the Philippines. People are paying more than $200 for these tests. In India, they're costing about $50. In different parts of the world, there would be much more or less, perhaps. And now, besides the equipment, we need to not only transfer the equipment, set up a testing facility, perhaps adding on to an existing laboratory or creating a separate lab, and trying to address those needs as well. And like Andy mentioned earlier, more than 60% at least over here of the people involved in procurement supply chain are pharmacists, and what we are looking for are biomedical engineers for this particular activity and laboratory experts. The challenge being, again, in Africa, just like there's not enough manufacturing happening in Africa, biomedical sciences and biomedical engineering is not as common as it is in, let's say, take India or some other parts of the world. It's a desperately needed area. Global Fund has been asking about how they can support various countries in this space as well. So, and before you can do any treatments, before you can move forward, you need to get the diagnostics in place. And that's some of the challenge as well that's to be explored. Over.
Thank you so much, Paul. We have 3 questions that are all related to forecasting and to the tool. So I'm going to read them out, and then maybe Sachin can answer them. One is from Guy Kachala, and he says, I would like to ask if the tool has a section on waste management disposal. The next one is how effective forecasting could be done with the changing testing algorithm and treatment options. If the trend in infectivity, the third question, if the trend in infectivity rate keeps on fluctuating and is not predictable, how can forecasting be effective and with what type of scenario? Sachin, over to you.
Okay, thank you. So, Bernadette, as suggested, I have also entered the reply to that changing infectivity and assumptions question, but I'll just quickly summarize that again. So basically, the tool itself allows you to configure, you can change the testing strategy, for example, but it is true, if you look at any epidemiological estimate, even by the best epidemiologists, if you see what they predicted 6 weeks ago and what cases you have, you will never find an exact match, right? So it's always different. But what forecasting allows you to do is get a broad sense, and you procure because you have to plan for the future. But what is also most important is how you manage your stocks, how much stock you keep and where you keep it, because your immediate need is going to be met by your stock, and your forecasting can help you to sort of build and fine tune that stock. So managing your inventory levels is very important. Forecasting alone will give you a sort of broad sense of what the needs are, right? And the tool has some flexibility to configure for like different scenarios, different testing strategies, different doubling rates. For example, if your doubling rates change, you can also enter that in the tool, right? And regarding waste disposal, unfortunately, I think Professor Andy also mentioned that is a second problem which is coming up and could become a big problem. But the tool, does not help. It's just about how much commodities you need. It takes care of for that. But you can give your feedback to WHO, and maybe in future versions they may think of they're always adding more features, and we also take this feedback, and maybe when we get a chance we'll also share. Thank you.
Thank you so much, Sachin. We have 2 questions that are sort of interrelated, and I'll read them out. One is from Gutom Gigar Abera. And he says, or she says, following the epidemic, it has had a negative impact on the pharmaceutical procurement process and chain. One of the major problems we have faced so far is the lack of transport, especially shipping and aviation services. And on the other hand, the factories in India have not been able to produce all the capacity, which has negatively affected the supply chain. So what kind of solution or strategy should be used during this epidemic? That's the first question. Celestine's question is, what is being globally done with the main focus to low-income countries being ready to respond to the high need of health commodities necessary in the COVID-19 response, especially in accordance with confirmed case management? So I think both Andy and Paul, these are questions for you. Over to you.
Shall I start and then, okay.
Yep, please go ahead.
Okay. Most of the factories in India are now close to returning to normal for manufacturing capacity. The disruption that was there is now much less. There's still some specific commodities which have a problem, but in general, they are close back to normal. So the difficulty is around shipping. We expect air freight to slowly improve, although to Africa, it will be slow on the improvement. The rest of the world seems a little bit better. And that means sea, land transportation, and extra lead time around all your regular commodities, extra lead time. At the end of the presentation, when you get the slides, you'll find 2 slides which mention the impact of COVID on normal health commodities, and particularly the pharmaceutical supply chain, impact measurements which are done monthly by the Global Fund and by UNICEF. So many Global Fund orders for antiretroviral medicines are being delayed by more than 30 days. However, with good lead time planning, ordering well in advance and allowing for sea freight, land freight movements, you should be able to manage the situation. What's being done to assist low-income countries? We've talked about the WHO procurement mechanism, the UNICEF, and the Global Fund procurement mechanism. They're there to assist you. Funding is a major challenge for everyone. But there are some funds available through Global Fund, and some reprogramming of your Global Fund grant may be possible. You need to discuss it in detail with Global Fund. They're only allowing a maximum of 10% reprogramming at present, but that might be a help to get you started. In the longer term, there's no good answer to the funding challenge yet. Okay, over to you, Paul.
Yeah, just to underscore what Andy said, and it's exactly for this mechanism that the Global Task Force by WHO and the World Food Programme was created, which includes a dozen other partners as well, because you don't want a situation where the rich and larger countries end up accessing all the necessary supplies to protect their population, and the smaller countries with less resources suffer. So there has to be equity in accessing these commodities. And the same things happen whether you're a small Caribbean island country that is being affected both by natural disasters and now biological disasters as well. At the same time, how do we help? How do we support? It's these global aggregating mechanisms that are required. And again, I'm just thinking ahead, as the vaccines are in the pipeline, some of them may actually work. Gavi, which is a global vaccine alliance, has secured some funding towards that effect. And a large part of the vaccines, although many countries are buying direct, Gavi's goal and objective is to ensure that there is, again, equity in accessing these vaccines for the resource limited setting countries as well. So these are the mechanisms that would be useful. So definitely go to the links that we've shared, and it'll guide you in terms of how you might be able to find a solution. Over.
Thank you so much, Paul. I see that the remaining questions have been very successfully answered by Sachin on the chat. And I see that, this has been a really interesting question and answer session. So what I would like to suggest is that before we go to the poll, maybe each of the speakers would like to share their thoughts about both the presentations and also about the question and answer. So could we start with you, Paul, then Andy, then Sachin?
Right. Thank you again. So, I mean, first of all, thank you for attending. We have almost 200 participants on Zoom, and there were others on the Facebook live chat as well. Thank you for your time. Thank you for your interest. and I realize the challenges that you're all facing in your countries. It's not easy. We don't have enough funding. We don't have enough information. Information in terms of from the supply side. We also don't have enough knowledge and information in terms of number of cases and deaths. And while we're working in this environment, which is highly ambiguous, highly dangerous as well, we're trying to protect ourselves, our families, and our countries. We need to be informed and knowledgeable to make the best possible decision in a very challenging environment. And this will continue for a while. So the best that we can do, and we're very fortunate that we have access to incredible knowledge and information and tools online through the various networks, but then we also have a problem where there's too much information and it's scattered and it's not aggregated. So it's really about knowing and navigating where to find the knowledge and information, and then using it to strengthen what you specifically need for your particular environment. And if in that journey you need any help, you of course have University of Rwanda. WHO is obviously a leading place for all this, although there's so much information there that you again get lost in that environment. But people like Andy, myself, anyone, whatever support you might need, we're happy to direct you. You've got Professor Kayumba, who's a stalwart in this space as well, and he is of course based out of Kigali, so available at any time as well. And although he's taking care of PhD students, I'm sure he'd be more than happy to respond to all your queries as well. So we're available, and the Regional Center of Excellence is also available. Happy to help in any way. Over to you, Andy.
Okay, I think the global community has responded by providing information and tools. There are catalogs, there are lists, there are guidelines. There is a quantification tool. It is complex, but it's relatively simple to use. It will give you a basic estimate. And because it's WHO approved, it carries credibility. Which means if you've quantified using this tool and you're looking for donor and funding support, it's much more likely to be received than if you've done 4 calculations on the back of an envelope. Okay. It carries that credibility. Use the tools, use the information that is there. All the links are available in the slide deck that you'll receive. Particularly at the end, you'll see additional slides with more links to the information. WHO website links change almost by the hour, but a 2-minute global Google search will get you to that information. The catalogs, the forecasting tools, all there. Please use them. Okay.
Thank you so much, Andy. Sachin?
Okay, I think Professor Paul and Professor Andy have already covered everything, so I'll just end on a lighter note. So, you know, the kind of supply issues we are facing for different COVID commodities. So when the vaccine will be out, of course, the production capacity is very limited, and we will not have those 7-8 billion vaccines immediately. So the first vaccines will probably go most probably to the frontline workers. So if any one of you wants the vaccine first, please go and work with the COVID patients in hospitals right now.
Thank you so much, Sachin. Professor Kayumba, do you want to add to the comments?
Yeah, thank you very much. Really, we appreciate such kind of presentation this afternoon. It's that kind of initiative we would like really to have at East African community level. The Center of Excellence will always be pleased to host such instructive webinars whereby we benefit from your brains, your very full brains. So I know we cannot cover everything in one single webinar, one afternoon. Maybe we keep in touch and we keep communicating with participants in the region, and eventually we'll come out with any other interesting topic in health supply chain management where we can make such kind of presentation, and we hope if we knock to your doors, they will be opened to us.
Thank you so much for hosting, and thank you so much for those comments. And I would also like to thank all the comments, especially from all the participants, thanking and appreciating the presentations and the slides. So I hope all the presenters can take that with them, but this has been really important and useful to everybody. So lastly, let's go to the poll, the final poll. So if we can have the final poll, please. And let's make sure that everybody gets time to poll for this poll. So can we have poll number 4? I'm not sure who's sharing poll, but yes. So the polling starts now. So please answer the questions that are on the poll. And let the poll be there for some time, because I see that it's taking time for people to vote and send their comments. And this is a very important poll, as we really need to have the feedback from all our participants. Excellent. Now we're up to 30% of the participants polling. And I also see that the accolades are coming in regarding the webinar. So really great appreciation and gratitude and thanks from all those who've attended. Okay, we've gotten 70% of those who are attending voting. That's excellent. Keep going. And also keep your comments coming. I see that a lot of comments are coming, and just to reassure everybody that you will be getting the presentations, you will be getting the slide deck with all the links and the information. I hope that will also be very useful. And now we've got 75% of the votes that are in, and they're still coming in. That's excellent. And this comment, yes, the presentations will be shared, and they are very useful for the current context. So all of you will be getting the presentation. And there's also a request that please keep up this interesting initiative. I hope that we'll be able to do that. Okay, now that we have 80% of the votes. It's been an informative webinar. Since we have 80% of the votes, actually 81 now, I'm just going to start reading out the results. The overall rating for the webinar: content, speakers, delivery, utility. It's excellent, 58%, good, 36%. Only 1% said need improvement, so that's really good. What did you like about the seminar, about the webinar? And topic, 42%, content, 51%, speakers, 39%, engagement of audience through polling, 34%, organization, administrative, 30%, all of the above, 51%. So thank you everybody for your input, for your active participation, for questions. And once again, on behalf of the Empower School of Health, I'd like to thank all the presenters, and I'd like to thank our co-hosts and Professor Kayumba and the Center of Excellence for making this possible, and also for all the administrative staff who've helped to put, and the technical staff who've helped to put this together at Empower School and also at the Center of Excellence. So thank you everybody, and good afternoon, good evening, good night, wherever you are.
And goodbye.
And goodbye.
Thank
Until we meet again.
Yeah,
Thank you, everybody. All the best.
Thank you very much.
Thank you for your time.
Goodbye, everyone.
Goodbye. Thank you, moderators. You did a fantastic job. Really appreciate it. Excellent. I see many faces. Moses, how are you? Oh, sorry. Let me.
Sonia, maybe you can unmute all.
Yeah, let's see if. Yeah, so that they can be free conversations. Admin, are you able to unmute all at one go?
Thank you very much.
Yes, sir. Yeah, that's great. Moses, good to see you. Isaka, good to see you. Wonderful.
Thank you.
Thank you. Long time, Professor. Nice to see
Long
you.
time indeed. Very nice to see you.
I wish you the best.
Thank you, and I hope we're able to support in any way despite the challenge you're experiencing in your country.
Thank you.
MashaAllah.
Paul and Andy, it's good to put a face to the names. Thank you so much.
And my greeting
Thank
to
you.
Professor Andy as well.
Yes, Professor Andy, we call him our encyclopedia.
So, maksudnya
As well.
apa sih?
Good.
Iya, masa.
I see there was Bastian as well. Bastian, thank you for attending. Neil, good to be connected again. It's been a while. Who else? I see Felix. So many people. I can't take all the names, but thank you again. Excellent turnout.
Thank you so much. Thank you so much.
Okay. All the best. Have a great evening. All right. Great afternoon.
Thank you.
All the best.
Thank you, Professor.
Thank you. We'll be doing another webinar in about a month's time. We'll be taking the names of topics from our participants, our students, and the countries where we are working as well. Okay. So
thank you so much.
every month we'll be following up with one webinar or the other.
We look forward to that. Thank you so much.
Yeah, we'll announce it well ahead of time so you can plan.
Thank you so much.
All right. Take care. I shall leave now.
Good night.
Okay? Bye-bye.
Good night.
Bye-bye.
Okay, bye everyone. Good day.
Okay, good night to all.